Am I on? Is it working? Oh, let's see. Are we coming now? Good afternoon. Happy New Year, y'all. I apologize. Yeah. Got to get back in that swing again, right? That traffic, it's out there. Hope y'all are all doing well. I tell you what, before we get started, I want to thank the committee for being here and waiting on me. Let's start with a word of prayer, okay? Dear Heavenly Father, we come to you today as we consider some very important decisions for our state, and just ask that you equip each of us with ears to hear and hearts that truly listen, to help to find the creative ways to bridge the gaps that we all know exist, and to make every day better for each and every Georgian. In your name we pray, amen. Okay, so are there any concerns right now from the committee? Anything anyone would like to share with us before we get started? If not, I thank you again for being here, and let's get started. Our first presentation is from the Georgia Department of Behavioral Health and Developmental Disabilities.
I'd like to address you from here. Is that okay?
That is great, whichever is most comfortable for you. Okay. And Commissioner, I want you to introduce yourself to everybody. Even though some of our committee may know you already, I am so grateful that you're here and that we start this new year together.
Thank you. Good afternoon. Thank you, Madam Chair and members of the committee, and Happy New Year to you as well. My name is Judy Fitzgerald, and new commissioner of the Department of Behavioral Health and Developmental Disabilities, social worker in the state of Georgia for 25 plus years. But it's a privilege to be here with you in this capacity today. And I'm very pleased that 2017 starts with everybody's eyes and mind on the budget for the Department of Behavioral Health and Developmental Disabilities. I think that's a great way to start from our perspective. You have before you a formal presentation which, as swiftly and efficiently as possible, I would like to walk through. I'd like to make two remarks before the formal presentation, if I may. The first thing is to acknowledge 33 days on the job as commissioner, but I stand here before you with some confidence about the information that you have, really as a result of the terrific efforts of the team at DBHDD. Several of those members are here with me today. I want to acknowledge one in particular, Jeff Miner, who's our Chief Operating Officer. And Jeff and Commissioner Berry and I came into the Department of Behavioral Health and Developmental Disabilities together in 2012. So the three of us have been planning and working in DBHDD for the last several years. So while I'm new to the role, certainly not new to the team members. Mary Price and Chris Hamilton from our budget team are all here. I'm really grateful for the team that supports what I'm going to present to you today. We couldn't do it without them. I also want to acknowledge, the second thing I wanted to acknowledge is the budget presentation. The budget before you really is built on unprecedented support from the General Assembly, from OPB and the Governor's Office. All of you several years ago, before I was in this role, recognized the unmet need in the state of Georgia, and you've made an unbelievable commitment to support the work that we do. So we are ever grateful for what you've already provided, but we humbly come to ask for more, some continuation of what we're doing, and to tell you about what we plan to do in the year coming forward. So with that, I'll draw your attention to the first slide, which outlines what I want to cover with you today. I'm going to give you a brief overview of DBHDD, and I'm going to do that by telling you a little bit about the people we serve, the provider network, and the progress that we've made. And from there, we'll talk about the FY 2018 budget changes, a little bit about our capital budget, and finally leave you with some of our challenges and opportunities today. if you want to follow along with the presentation before you, you have a slide that points to our vision statement, which many of you have heard before. Easy access to high quality care that leads to a life of recovery and independence for the people that we serve. I just want to spend a moment on the people that we serve, because really, in the end, that's why we're all here today. But I want to make a few clarifications, because the work that we do and our budget can be complex. So I just want to say a little word about the people that we serve. You know them well, because they're everywhere in our communities. When we use the term people with mental illness, to be clear, we're talking about people who have diagnosed illnesses such as depression and schizophrenia, mood and thought disorders, which you may see as behaviors in the community and in other settings. That's what mental illness, that terminology. You also are familiar with people with addictive disease, that's substance use of any kind, drug and alcohol. I make a point to use these two terms. We use those two words together. When we mean mental illness and addictive disease, that's behavioral health for us. That's how we get to behavioral health. So I want to clarify that language. And then the third area of disability that our department covers are intellectual and developmental disabilities. These are folks with cognitive and developmental impairments, so individuals who before the age of 18 have an IQ less than 70, for example. So I mention that, and I'm talking about all of those individuals as if they're very discrete categories. But I want to make the point that people are quite complex. And so individuals that you may know that have some of those illnesses, actually, it may be a little more complicated than that. And they might cross service system deliveries. And this is part of what leads to the complexity of our service delivery system. So while those are different diagnoses, each of those disability areas in some other states are completely siloed. In some states, they have a Department of Mental Health, a Department of Addictive Disease, and a Department of Developmental Disabilities. Here, in fact, we think we're fortunate because really people are people and we want to serve people. But it does make for a complex budget and at times complex presentations of what individuals need. So as we talk about the dynamic healthcare environment that Georgia and every state is facing, really just wanted to be clear about our commitment. Our commitment is to serving people, and understanding what they need is really the most critical work that we all do. And in fact, when I tell you about all those folks, what we know is that everyone in this room is touched by those populations. There isn't a person in Georgia that isn't touched by these disabilities of the folks that we serve. On the next page is our mission statement. And this really says a lot about what we'd like to tell you a little bit about today. What the department is trying to do is to lead an accountable and effective continuum of care to support Georgians with behavioral health and developmental disabilities in that dynamic healthcare environment. What does that mean if we say a continuum of care? To be clear, what exists in the state of Georgia and what DBHDD is responsible for are 5 state hospitals and a very large network of behavioral health providers and intellectual and developmental disabilities providers. In fact, there are approximately 258 behavioral health providers and 382 providers of individuals with intellectual and developmental disabilities. The reason this is important is because if we manage a network of providers, we better get good at delivering accountable care and holding providers to delivering accountable care. So you'll hear a theme from us about accountability and the ways that the department is working to ensure accountability within the system. We want to be able to say to all of you, when you generously support and you make a commitment to support the people that we serve, we're going to be able to tell you where those dollars go. So on the next slide, I'd like to take a minute just to share with you some of the accountability measures that we've put in place over the last 3 or 4 years, certainly since we came into our respective roles. And you'll see, what you see on that page, I'm going to talk first about accountability measures in the behavioral health network, and then I'm going to tell you just a little bit about accountability measures in the developmental disabilities network. We can't do this work without our providers. Our providers are the lifeblood of delivering services. It's our job to facilitate everything possible in order for those providers to deliver services and make them accessible and high quality. But when we came in, the network was of variable quality. And most of the members would acknowledge that. What we believe our role is critical is to standardize and have a predictable service delivery system. So then every community in the county, you can count on a certain array of services that should be available to these very vulnerable populations. So I'll walk through quickly, and I promise you, if you want me to come and spend an hour on each one of these at another time, I'll be happy to do that. This has been really at the heart of the transformation that we've tried to lead at DBHDD. Not long after we came in, this work was already underway, but we redesigned the provider network, and this is in behavioral health. I want to just share some simple things, as simple as putting in place service definitions and standards so that when a service is delivered in a clinic, you should be able to know what that is. It should be clear what that is, and a provider should be held accountable for that. That's pretty fundamental. That wasn't originally in place in a clear and defined way. We also arranged the network into 3 tiers, and each of the tiers has different responsibilities and different allowances and could provide different parts of the service array. This really helps to clarify what our expectations are. So along the way, as we did that, not only did we say, here's the services and here's the standards, we also said, now we're going to start to measure how you do in that. And we have a set of key performance indicators that we now collect information on a regular basis so that when you ask us, are we improving access? Are we improving crisis response? We now have active and real-time data where we believe we can tell you that the dollars are being spent in an accountable way. The third element of the accountability transformation has been around the financing of our system, and this is really big and transformative. 2 elements, one of which you probably have heard about, which is on July 1st of last year, we implemented a fee-for-service. And that's a very basic way of delivering a service. You deliver a service, you get paid a fee for that. That's a pretty rudimentary way of doing it. But what was in place in advance of that was providers received a 1/12th payment and throughout the course of the year. And we really did not feel like we were able to say to you, we know where the money goes. We want the money to go to services. Fee for service is the most basic way for us to get an understanding of what it costs to deliver a service and where the need is in the state. And therefore, that helps us understand where we're not meeting the need. So that's been a big transformation. It's been difficult and a challenge for the providers. We spent 2 years preparing the provider network for that, and I do have to say they've come along nicely. And this is the transformation of our system, getting ready for a healthcare environment which really expects that we can all be accountable. And where fee-for-service was not the right way to deliver, we also have cost-based reimbursement. What I hope you're hearing is a commitment to accountability and transparency in the dollars and the services that are being delivered. So in order to do that, the 4th item that you have on here is the Georgia Collaborative. That's our partnership with Beacon Health in order to, and we have a phrase on here that I really think is true. DBHDD manages a network of providers. We want to apply managed care strategies in the public sector. So we want to understand utilization. We want to understand access. We needed an infrastructure mechanism in order to do that, in order to help us collect data in real time. So that is underway, and we're now able to measure where we stand in terms of access, quality, and efficiency. All of those are the tools that really help us try and commit to you that we're working towards a more accountable network. On the next slide, I share with you a little bit about what we've done in the provider network for intellectual and developmental disabilities. This is a different service system. Many of the folks that receive services are on waivers allotted through funds from you all and the feds. But we've done a couple of critical things, again, to ensure accountability in that network. One of the most important things that we did was overhaul support coordination. Support coordination is our language. What I want you to know that it means is every individual who's on a waiver has an advocate, a support coordinator, a care coordinator. Some of the services these folks receive can be complex, and navigating what folks need, we had to overhaul the way we do support coordination to assure that individuals had an advocate that can help them access what they need. And then you see a service we call intensive support coordination. For many of the people on waivers in the state of Georgia, their needs can be very complex. And so we have a higher level of intensive support coordinator with additional training and additional experience to really help navigate perhaps the healthcare community and again, meet the needs of individuals who living in the community when the community is not fully ready or trying to work on readiness for those individuals, that intensive support coordinator can help. Another thing that we did, I think y'all are very familiar with, since the agreement with the Department of Justice, one of the biggest efforts has been transitioning individuals from the hospital to the community. We no longer allow individuals with intellectual and developmental disabilities in our hospitals. So reorganizing the way we help people prepare for, and we have individuals who've lived 20, 30, 40 years in a hospital, and readying those those individuals and their providers to live successfully in the community required us to transform the way we do business. So we had a major effort around that. And the item you see next, the Office of Health and Wellness, we have stood up within the department an entire office led by one of the nurses from our hospital to really have a more accountable and more visible clinical oversight of the individuals. Again, imagine individuals who've lived decades in a hospital and have complex needs. We want to assure that we're providing the clinical oversight that's needed for them to live successfully in the community. And then finally, you all are well aware, we conducted a rate study for residential services in developmental disabilities, and the rate study said clearly we needed to increase our rates, and you approved, and that money was in the budget. Right now, the status of that is we are awaiting approval of the renewal of our waiver from CMS, and we cannot activate the rate increase until CMS approves the new waiver. So we are eagerly awaiting, and we're in conversation with the Department of Community Health about what we can do to advance those efforts. Okay, so that's kind of really a snapshot of what we tried to do. On the next page, actually the next 2 pages are looks at the DBHDD budget. And the first one is a really high-level snapshot of our FY 2017 appropriation. And we show you this one in this way, and this should look familiar, y'all that have seen our budget for several years now, is to really show you the difference between our community and our hospital budget, and really then also to make a continued commitment to you all. We break out the administration within our total budget to assure you and to demonstrate that administrative portion of our budget is 3.3% of the total budget that you see there. And we have a continued commitment to keep that administrative cost as a minimal part of our budget, and still want to be able to guarantee efficient and effective oversight for you. So that's a high level. If you turn to the next page, you see further detail by the program areas of the department. So if you have an interest in any particular disability or developmental age, you can see by breakout there about what each area of the department, what the 2017 appropriations are. And I'd be happy to answer questions about any of those. The idea was just to allow you to see a little more clearly by program type. On the next page, we have another look at the budget, and this is really a trend look, and this is an important point for us to make to you all. I have a caveat about this. These trend lines represent state funds only and service programs only. But what we wanted to demonstrate here, you see a yellow line with annual increases, and then the red line, which is staying fairly consistent. That yellow line is our community budget, and the red line is hospital. The increases in the yellow community budget really come from two places. One is where we've closed hospitals and been able to put that money back into our services in the community. And then the second place is from the allocations that you've provided through the agreement with the Department of Justice. The funds that you all appropriated, that's really helped us to build up the community services. We would expect that these trend lines will continue generally in this direction. We are trying to support a life in the community for anyone who can live in the community and receive services in the community. We hope to continue to build the network that is available in the community. That said, we also anticipate that we will have hospitals going forward. We do have a need to retain state hospitals. There are individuals who have chronic needs that cannot be served in the community. We have forensic individuals that need to be served in our hospitals. And I can give you an update. As I mentioned, we no longer can admit individuals with a primary diagnosis of intellectual and developmental disability in the hospital, but there still are approximately 230 individuals that are in the hospitals right now. Where the hospitals exist, we want to assure high quality of care. So we expect that you'll always see a hospital budget, but it will stay fairly static. So thought we would just share 2 points of progress with you. The first, tell you a little bit about progress on the agreement with the Department of Justice. You all should know that we were able to achieve compliance with the majority of elements that were in the 2010 agreement, and that was no small feat. Really have to give credit to both our team and the providers who have stepped up in incredible ways to deliver some very aggressive targets. But there were a number of items that at the end of the target period that had not been achieved. And so over the course of several weeks, we painfully negotiated with the Department of Justice. And what remains now is a 2-year extension agreement that incorporates the following elements that we're continuing to work on. One, the transition from hospitals. So those individuals with intellectual and developmental disabilities, we are required to continue to move individuals to the community at a reasonable pace. We do that really through the waivers, and we call them the comp waivers, and also now waivers to help move individuals off the planning list. The idea is making a life possible, a life of independence possible in the community. We also have some obligations for ongoing community oversight of individuals that are in the community and partnering with providers in order to do that. And the only area remaining in the extension agreement in mental health, all of these other areas are in IDD, the only area remaining in mental health is supported housing. And already Georgia is a national model with the work that we've done, the funds that you've given to support us, but there's continued obligations to increase the number of supported housing vouchers that we have. So what you all know, and you have heard this figure before, and we stand grateful, the total funding received over the original settlement agreement period was $171.5 million. It's transformed our system. And if you flip to the next page, this is really kind of a dense page, the takeaway, why we show you this page is to show you what $171.5 million on paper, what we were obligated to do, and in fact, almost every case, what we were able to achieve. So this is unprecedented, it's excellent, but 2 points about it to be aware of. These services that you see here are at the deep end of the continuum. They are not the basic infrastructure of mental health services. They're for crisis services. They're for the deep end of most in need. That's critical, but it's not the entire story. And we need more of it. And I'll say that a little more about what we hope to accomplish in the crisis services that we need. So again, want to make a point to say thank you for the support that you've given us, but also just acknowledge there's more work to be done. And the new extension agreement, the good news is, if you read the extension agreement, it's all the right work. It's the building that we want to do. The challenge we'll have is that the targets are very aggressive, but the team is poised and ready to continue to pursue those. The other point of progress that we wanted to make note of, what you see as agency accomplishments. Again, and these are due to the support that y'all have provided to us, but we've and some of the elements that we have here have a mix of impact across disability areas. So we've made progress across DD and behavioral health, and a few of the items here, 75 new waiver slots from the FY16 funding, 100 now waiver slots from FY17 funding. We implemented, as I mentioned earlier, intensive support coordination. We continue to expand CSU BHCC capacity. I want to say a word about that. Again, we're using our lingo there, and I want to make sure you know how critical this is. CSUs are crisis stabilization units. A BHCC is a behavioral health crisis center. That is sort of the most robust community-based center that we have, where an individual in psychiatric crisis could be dropped off for evaluation. We have observation beds, and then we have a full crisis unit within that. These really, where we've been able to build those and place those, they've had a tremendous impact in the community. We know judges, sheriffs, emergency departments that are very pleased. So you will hear us continue to say, these are transforming what's possible at the community level. It's been extremely helpful. We also want to acknowledge one of the things that was critical. We have workforce issues that you all are well aware of. They exist in every portion of the state. For us, the most critical area that we needed to tackle was the direct care in our hospitals, our frontline folks, what we call human service technicians, people who in the hospitals day to day are directly serving the patients and the individuals that are there. Last year in 2016, we started, and now we're annualizing a pay increase for those individuals. We simply cannot recruit and retain staff without that increase, and already we're seeing that it's making a difference in our ability to recruit folks to work in our hospitals. One of the things that's most important, again, for us to be able to commit to you is that when you allocate dollars to us, we are going to spend them in service of delivering care to people. So the last bullet you see there is that we spent 99.9% of our budget, and we will commit that our interest in accountable and transparent service delivery is what we're trying to do. Okay, so that's a fast run through where we've been. I do want to talk a little bit about what our hopes are for FY18 and tell you, you see our 2017 and 2018 agency budget priorities. We will continue to talk about our desire to ensure easy access to high quality care. For us, from a priority perspective, that means a couple of different things. One, crisis services statewide. And I think you all are hearing the same thing. When people are in crisis, we want them to be able to access the level of care that they need. But now I want to say something about that second bullet, which we call the core services enhancement, the outpatient benefit package. People need crisis services sometimes if what they can get access to on a regular and daily basis isn't working. And so, as I mentioned, when all those dollars came in through the settlement agreement, they beefed up the deep end of the system. What we now want to do is go back and rebuild some of the infrastructure so that people can get the right level of care as quickly as possible, and that we're using those crisis services only when people can't, when truly there's a crisis, or when they can't access what they need. But the goal is to build a robust and comprehensive core infrastructure, and we need dollars to do that. We haven't done that. We haven't invested in the core infrastructure in decades, and we believe now that we can tell you where the money's going, we really think that it's time to enhance the regular benefit package. Our forensic services, this will be an ongoing challenge for Georgia, as it is in many states. I think a simple way to understand, so forensic individuals are those individuals who are in our care but are involved in the court. They have a legal charge of some kind, but they're incompetent to stand trial. We may be trying to restore them back to competency so that they can stand trial. But in any case, Georgia's population growth, our forensic services have not been able to keep pace. And this is really critical. Again, where we can build those forensic services, it really makes a difference in the community setting and for those individuals. We want folks to be in the right place for what services they need. The next agency budget priority is the clinical employee salary increase. So I told you about what you have already supported, and it was really transformative, was the front line. Now we have the other piece, which is our clinical staff, our nurses, our psychiatrists, our social workers, all of those clinical folks that really deliver the quality clinical care that we want to have in our hospital and settings. We really have difficulty in that we are not competitive in our recruitment efforts. And so we're bringing to you some requests for increased pay across the board for clinical folks so that we can be competitive. We're trying to make our hospitals a place to work, but we need help making sure that folks can be compensated for that work. And then the last one there, we're going to continue to see a need for housing dollars for individuals as we as folks start to step towards recovery. The most critical part of recovery is having an adequate place to live where they can continue on the path for recovery. So those are our priorities. The next two slides that follow just break out those priorities. The first one represents our official budget submission to OPB. And you see there FY17 and FY18. And we've broken out exactly what each of the official budget submissions are here. And it's a continuation of the narrative that we have here, which is in DD, 250 new waivers. And you can see a little bit of detail there about part of that is 6 months of funding for FY17 and then annualizing that. So you see the 17 and the 18 numbers there. Same with adult mental health. In housing, you see the initial number in 17 and then that's annualized in 18. And then again, annualizing waivers, 100 waivers, and the new DD waivers, those are both for 18. And the next item on there is the rate increase, again, which you all already have supported, and money is in the budget. We just await approval for our waiver. The final two items, the BIP restoration and the FMAP change, those are FY18 figures. And for BIP, that restores some state dollars to us from the Balancing Incentive Payments Program. And the FMAP changes help us to maintain Medicaid dollars. The next, as mentioned, in addition to those items, we have some internal priorities for DBHDD, and I've touched on each of these, and I'll just say a word more. The hospital clinical employee package, again, we're optimistic. We really need to be competitive in the market and recruit and retain high-quality clinical folks that can work in our hospital system. We're also asking for 2 new behavioral health crisis centers. So that, as I mentioned, is the most comprehensive and robust crisis response physical location in the community. We would ultimately like to have one of those available at least one available in every one of our 6 regions. We started by, when we came in, by placing them where we closed a hospital, but we still have gaps where we believe, and we will keep asking, at a cost of about $6 million each. That's about the annual cost. So here we're asking for 2. And the core services development, that outpatient benefit package, we're asking for $20 million, again, to build the infrastructure so that we don't become overly reliant on crisis services. What we believe that $20 million in the core package would allow us to do is serve 17% more individuals in the state of Georgia, which is about 18,000 more people. We feel like when people talk about access, these are the problems that we want to solve. Some of the access doesn't always have to be at the deep end of the system. We'd like to have it in the regular benefit package. The last item you see on here, on this particular slide, is for a 40-bed forensic unit at Georgia Regional Hospital here in Atlanta. This actually is going to be a 2018 request, but did just want to let you know we already received the capital funding in FY17, so the work is underway, and we look forward to, that's a highly pressured system where it's easy for us to have a backlog in the forensic system. You will hear from sheriffs and others, and it's really important for us to both have community services available for that population, but also we need that 40-bed unit, and that'll be coming up in 2018. The next slide just gives you a total picture of all of that. So I'd like to move quickly just to give you a snapshot of the capital budget. Because as we spend a lot of time talking to you about the community and community services, and this is where the field is going. Everyone's moving towards community services, but we can't walk away from this very practical reality that we have 5 hospitals, which actually and on those hospitals, we have 469 buildings and 5.5 million square feet of real estate that we are responsible for the upkeep of. And you well know that some of these buildings are quite old and requires a lot of funds to make sure that we have appropriate upkeep. So the capital requests are really critical. The first one, the Savannah Treatment Mall, let me just say a word about that, because what is a treatment mall? A treatment mall in a psychiatric hospital is where people get their services. It's as we move away from sort of a medical model and a custodial model. When folks are in our hospital, even with chronic needs, we're trying to prepare them to live in the community. So the mall allows for an array of educational, psychosocial rehab activities that help individuals really be prepared to live in the community. So that's critical. This is the last. Every hospital now has a treatment mall. Savannah's the last one of our hospitals. So, and then the next 2 items are our renovations and repairs and sustainment and repairs. We do this work through bonds. We do not have operating infrastructure budget for the hospitals for the ongoing repair that's needed. We don't want to have to use operating dollars for that. So you see the requests here for the 20-year bonds and the 5-year bonds. This totals up to $15 million in capital funds requests for us. I'd love to tell you about our some of our challenges and our opportunities. In the interest of time, the next slide you see, I believe I've talked about most of these, about what we need in core funding, that we need continued crisis services and housing improvement. We do have a planning list for DD, and one of our efforts in the coming year will be to prioritize and to understand really who are the most in need folks and how can we streamline our ability to get folks from being on a planning list to service delivery in the community. And we need to ensure that we keep our rates for providers competitive. We want good providers in the state of Georgia, so we have to have rates that attract providers. But the final page really are some challenges that are, and there are areas that I know some of you are interested in. The first one, addictive disease capacity enhancements. There's a lot of interest right now in a lot of areas related to addictive disease, including opioid use and other areas. We have undertaken a strategic plan. We're working closely in partnership with other agencies. We know federal dollars are coming, and our department stands poised to be strategic in accessing those dollars and using them where they're most needed. I mentioned about forensic services and our need there. I do want to say one other word about that population. For folks that remain in our hospital, who are going to stay in our hospital for their lifetime, are aging. And each one of our hospitals has begun to calculate what's the increasing cost of care for those individuals. Our hospitals sometimes are not equipped to provide the medical care, so those individuals leave our psychiatric hospital, go to another hospital, and the aging of this population has become a real challenge for our hospitals. Workforce. This will remain a challenge. And finding the people, finding clinical folks, and then making sure they want to come work for DBHDD, that will remain a high priority. And then finally, we make a commitment. I know some of our sister agencies, you'll hear from them today. I think you'll hear from all of us a really strong willingness to be working cooperatively. We hated to see Commissioner Berry leave from DBHDD, but the good news is he's going to a partner agency, and we really believe that DBHDD and DCH can cooperatively really address some of the deep healthcare needs in the state of Georgia, and we look forward to talking more with you about that. Whew.
Take a deep breath. Yeah, y'all have been doing so much, and I appreciate it very much, as I'm sure the committee does as well. So we're lighting up with some questions, and they all came on right at the same time. So let's start with 23, and I'm going to get your numbers down. Representative Oliver.
This is a question for you, Madam Chair. Is this going to be our only opportunity to have a discussion on behavioral health, or do you know our schedule?
At this point in time, I believe that there will be more discussion about it. But if you have some questions, it's certainly an appropriate time to ask.
On page 17, in relation to the new forensic unit at Georgia Regional Hospital, there has been recent attention on the need for forensic for the DJJ population. Do any of these 40 beds, would they be open in any way to a 16-year-old or 15-year-old?
No. The adult population is kept separate, so we have no intention of youth being able to access those beds.
In relation to the comp increases, I've been hearing from constituents that the increases that we budgeted hadn't come, and I didn't know that you needed federal permission. Did we budget that money for 17 and you have it not spending it, or did we not budget it for 17?
It's budgeted, and
so we're not
yeah,
spending
we haven't.
it.
We're not. Yeah, the waiver has to be approved. 6 months worth was in 17, so we're
that'll
waiting
be
federal approval.
A collection of money that's unspent. Do you intend to award those rate increases retroactively? No.
I don't think we're able to do that. So our efforts are really on pressing CMS for approval of the waiver.
And how much money is that's in our 17 budget that's not going to be spent? I'm just trying to think about the surplus that's going to be.
There may not be a surplus. It's 6 months worth of funding. So if the waiver's approved now, we'll spend all the money. and originally we thought they were gonna come in on their birth dates across the whole year. That's why we asked for half the money, because some would be in for 12 months, some would be in for 1 month. And we thought 6 months worth of funding would allow us to attrit everybody in over the course of the whole year. With the delay of approval from CMS, we've gone ahead and assessed everybody. So pretty much everybody's ready to come in now. So if they approve it, we'll spend all of the money appropriated for in 17.
What's your best guess on when you'll get approval or denial?
We're working actively with Department of Community Health, who's got that. That's who the waiver gets submitted through. And I think Commissioner Berry's presence over there, we're optimistic that we can open up that dialogue. It's in nobody's best interest. The Department of Justice is eyeing us saying, why aren't you making these changes happen? And we're saying, if you'll approve the waiver, we are teed up and ready. So we're optimistic.
Thank you, Representative Oliver. Representative Kirby.
Thank you, Madam Chair. Over the years, and it doesn't matter whether it's your agency or any department in the state, we hear the same thing. We can't recruit and retain with the pay we're paying people. Can we ask you, and there's probably some others out there, so I don't have to repeat this over and over, to get a list of job classifications and the pay range they are currently and where you think they should be to be competitive in the marketplace? I mean, we can have all these great programs funded. If we don't have the people to run them, no matter what department we're talking about, it doesn't make sense. So if we've got to start finding where our pay scale should be, we need you all to define where you think it is, or tell us where it is now and where it should be in all agencies in the state so we can get quality people in place. And would that be possible to get that list to us?
Absolutely. Thank you for the question. And we've got lots of background. It's not going to take us any time because we've already got that. We're looking at it. Our HR folks are looking at that on a regular basis.
And if there's a regional COLA part to it, let us know that as well, because I know it costs more for Atlanta than it does South Georgia.
Thank you for the question.
That was an excellent question. Thank you. And we'll look forward to getting that information.
Absolutely.
And getting it to the committee so that we can be prepared for the next time we're together. And Representative Benton.
Thank you, Madam Chair. Appreciated the presentation today. I've got a couple of questions about the waivers. Can you give us some idea how many people are currently waiting on the waiting list?
On the planning list right now, there's a little over 8,000 individuals.
Okay. That's about the same number as it was. In other words, when we issue a waiver, we issue one and we have 10 more that want to come on. Is that basically what's happening right now?
Basically, and the language that we use in there about prioritizing who's on the waiting list. The waiting list right now is divided into a short-term list, really sort of suggesting those are folks with immediate needs, and then a longer-term list. But even within that, we need to do a better job of clarifying who's next and how do we efficiently move them onto a waiver.
Can I continue on, Madam Chair? On your page there for state fund changes for fiscal year 2018, you showed that you had 6 months funding for waivers on the 250, and then you went on to say on your page there that you're going to fully fund those for 2018. But are there any new numbers? In other words, besides this 250 that y'all are going to fund completely, that we did 6 months with last year, are y'all going to add any in your budget? Do you have any more waivers to be added? In other words, instead of you got 250, are you adding another 10 or 20 or 30 in the budget?
Yeah. Not formal. But that was 17. Yeah, not in it.
I understand what the governor said about that. Everybody's going to have to kind of hold it. That he's looking at roughly 4%. But if it comes to us to have to add the numbers, I just wondered if you went out on a limb and said we need to add 100 new for waivers instead of waiting for us to do it.
So we're interested in moving as quickly and responsibly as we can with moving folks from the planning list to the community. Let me be clear about that. We do have some challenges of how quickly we can do that, just the infrastructure and the movement, and then making sure we have providers ready to do that.
Okay.
But yes, moving as many people as possible is always our hope and our goal.
Well, in the supplemental 17 budget, are you looking for us to add some more money to these waivers? And in the 18th budget, are you looking for us, the committee, to find, Madam Chair, looking for us to find some additional dollars and maybe put that money with some more waivers? Is that what we're looking at?
So, yeah.
Do you understand? I hope
No,
I'm
I
being
don't think
clear
I
on
do
the question.
understand.
Okay.
Yeah, I'm sorry.
Am I being clear on what I'm asking?
I think I'm not understanding it, which doesn't mean you're not being clear.
Well, last year, the committee, y'all didn't ask for any waivers, and the committee gave, we added money to the budget to get those waivers. Now, y'all haven't asked for any more money for the waivers except to do them that original 100 for this
From
next
which-
year.
yeah,
Now, are y'all asking for any more than the 100 in the budget?
Yeah, 250 in 17 and 250 in
In
18.
18.
Okay,
So 100 annualized, 250 in 17. We get
And-
6 months worth of funding, it's annualized in 18, and then 6 months of funding in 18, it's annualized in 19. So 100 and 250 for this year, so 350, and then 250 in 18.
18.
okay, all right. One final question, Madam Chair. We are going to see a change in Washington starting January the 20th. Do you expect any change in negotiations with justice with the new administration coming in?
I do not. I believe we'll be held to the agreement that's been signed, which takes us through the next 2 years. So I believe everything that's in the signed agreement will be held accountable to. It's a bit unpredictable right now what else might happen, but I think we'll be held accountable to what's in the current extension agreement.
Okay.
Does that answer your question?
Yes. Thank you, Madam Chair.
Thank you. Representative Henson.
Thank you, and thank you for your wonderful presentation.
Thank you.
And the handouts are really great. A few questions. I think they're all location. Where, of course, we always lose things. We talk about more mental health housing services, which I assume are purchasing of houses to put people in neighborhoods. Is that correct?
It's actually vouchers that make it possible for the individual to live. It's not so much a purchase of the structure, but an actual voucher that allows them to live in an approved, in a setting that's selected by them.
Okay, then there was another that you wanted to build 2 new centers.
Yeah, the behavioral health crisis centers.
Yes,
Yes.
yeah, where are you looking?
So right now, we are planning the 2 regions that do not have a behavioral health crisis center are our Region 3, which is the metro area, and Region 5 down in Savannah. And so right now, Fulton and Savannah are our targeted areas.
And lastly, a sec, the CSBs. Do you control their budget?
We provide their state the funds.
That's what I mean.
Yes.
Now, as many years as I've been here, they've always come to us because their budget's always been gutted more and more. And the sheriffs, get upset because they end up housing them and, and they need the CSB. What are you doing with the CSB budgets this year?
So let me answer that in 2 ways. The first thing is we all do need to be more clear about funds that they have available. This was the whole reason for going to fee-for-service, right? So we could understand how dollars are being spent and agree where there's unmet need, we want to support it. But that core package that we're talking about basically is about having, CSBs exist, there are safety net throughout the state. Where CSB is able to deliver those services, we want to be able to provide sufficient infrastructure funds so that they, in fact, if they have unmet need, if they can deliver it, we absolutely want to channel funds to those CSBs where the need exists.
So DeKalb would not be looking at having cuts and having to close beds.
So, no, where safety net providers are efficient and effective, we will, fee-for-service allows us to see who's delivering what, and then really begin to incentivize where service delivery is happening, and where there's unmet need, channel dollars in that, or where there's a need, where there's a volume issue, and DeKalb could be an example of that, right? That they need additional infrastructure in order to deliver what we want. Or in some cases, we just want something in a place, even though the volume isn't there, we want coverage throughout the state of Georgia. So we'll use state dollars to cover areas where we believe just a straight fee-for-service model won't work. But what all of these accountability improvements allow us to now look at that in a different way that really, frankly, we weren't able to do before. We want to be accountable to you.
And then lastly, you talk about the ability to hire and to retain personnel. It's critical. I mean, articles that I've read, repeatedly, we've all been reading them, we've all been seeing it, the difficulty with hiring someone, and then once you get them trained, they turn around and they leave. And I mean, if there's one thing that we really need to do, and that is put money into personnel to be able to attract and to retain.
Thank you.
And
Yeah,
thank
we
you for
wholeheartedly
seeing
agree.
that, and thank you for working with that.
Thank you. Thanks for the acknowledgement.
Thank you. Representative Epps.
Thank you, Madam Chairman. Thank you, Commissioner. And I want to be brief, Madam Chairman. Really, I hope I can be. And I was encouraged to hear you say toward the end of your presentation that working in the future with sister agencies that you. My issue is maybe it's ignorance on my part of the whole process. But there's a maze that we as legislators have to go through in trying to help constituents for services. I have spent the last year with your predecessor in trying to accommodate the needs of a constituent in my district. We go through dealing with issues of being Medicare eligible but not Medicaid eligible, and then you not having the avenues to collect the services. And each time we submitted required information, it was like a 60-day turnaround before they would even hear back. If they heard, in some cases there was never an answer given. We spent over a year with BDHDD trying to navigate through this. Lost 2 opportunities to be placed in a facility because of the time lapse. And then just a month ago learned that, or was informed that from the beginning this was an issue we should have been working with DFACS through on a age, blind, and disabled waiver. Had it not been for Director Cable kind of just stepping forward and giving me a map of direction to go through, I get, without trying to be oversimplistic, if I have an issue with veterans, I can call the commissioner there. I mean, regardless of the issue, and gets at least in the direction that we need to be as far as legislative assistance. But when it comes to these agencies that you have specified areas that I'm not aware of, that it's not within the purview of behavioral health, but it's actually something we should have been dealing with DFACS with from the front. We've lost a year. had not been advised that that was even the direction we had to be in. I guess my concern is moving forward, is there some type of simplistic way to say, you know, legislator, you need to move, or maybe you need the benefit of more information than we're able to provide initially. It's a time lapse for me to get back to constituents and constituents to get back to me. But in the process, we're losing valuable services for them, primarily through the fact that I just did not know where the emphasis should be placed. Hopefully we can have a little more continuity, or at least the fact that if it's not within this agency and it's with a subsequent agency, you don't have to start from the very beginning to initiate the process. You can certainly contact one another and or offer at least an insight into where we are at this stage and what we need to. It's just complexity that I have a concern with, that we can't know every minute factor of what your agency requires or another agency, but it's something that I think impacts our ability to help our constituents, to make them aware of the availability of services and where they need to go, and not have to wait 30 to 60 days for a response that in the end says, well, we don't, you know, this isn't with us, it's with another agency. That it just seems that things are too territorially divided, and that there's no avenues that we can take to at least make sure that the work we've done to this point can easily be transmitted to the proper place and save us from having to start the process and restart the process. Listen, I'm indebted to your predecessor for the efforts that they put forth, and Director Cable for what he is trying to help me do with it. But it's just a constant, I guess I'm sorry, but this isn't where we need to be with in this direction. I don't know where our emphasis needs to go a lot of times, and I depend upon your agencies and your personnel to just tell us up front that we'll help in any way we can. But I think this, what you're asking for, is not within this agency's responsibility or this agency's ability to. Am I making sense?
You are. I'm
there's
sorry.
Just a real divide there that doesn't help us help constituents that are in critical need of this in the end. But thank you for listening, and hopefully we'll have a great relationship in trying to bring forth in meeting the needs of our constituents.
I'm very sorry for what you experienced. That's heartbreaking, and I know I can commit to this. We do not have the expectation that you all should be experts in how to navigate what is an overly complex system. You should be able to call us, our constituent services. We should tell you, even if it's not through rules and regs and it's not ours, we need to navigate who you need to speak to in the state. And I commit to you that our agency will continue to make every effort in a timely way to make that happen. That's wrong, what you experienced, and I'm sorry.
Thank you, Madam Chairman.
Thank you. I think that brings to light how important the work of DBHDD is and how intertwined it is with every other agency that's in this room right now, and every care provider and heart that's here today. We have gone through a very complicated time. We're still going through it, no doubt. But I think that it's powerful that your time went on so long. I hope everybody understands that, and we have plenty of time to get to everyone else. But I do think that there is so much that just falls under you, and then how we must all work together. And I'm well aware of the coordination that is being built right now of services. And I look for it to do even more. But also as a legislator, I can tell you that in all of these agencies that we're going to hear from today, they're some of the hardest ones I personally feel that we have to deal with as a public servant, as that unique call that comes to you. And sometimes a staff member doesn't even know how to help us from our side or from yours. So that might be something for us all to think about as we work with the coordinated care to try to figure out, just putting in our hands as well a list of contact this, this is, just we need that. And I often say that, when you're elected, whether newly or you've been here a while, it's often like looking for something that you don't even know where to go look.
Yeah.
So, help us, help those that you are also trying to serve. I thank you for your time, for the enthusiasm that you're bringing to this, and I know, Commissioner Fitzgerald, you are going to do a great job, and we want to be there to help you do that. So
Thank you, Madam Chair, and members of the committee. I look forward to working with you. Thank you.
Okay, so we will move on to our next presentation, which will be with Commissioner Robin Crittenden from the Department of Human Services. And perhaps Director Cagle, too. Good. And we'll... I think we've got y'all ready whenever you're ready.
Okay. Good afternoon, Madam Chair, members of the committee. Each of you should have in front of you a copy of our presentation, and we're going to be pulling it up on the screen, I believe, in a moment. Excuse me. My name is Robin Crittenden, and I am the Commissioner of the Department of Human Services, and I'm joined here today by Bobby Cagle, who is the Director of DFACS, and several other key leadership team members from DHS and DFACS are also here as well. Today we're going to walk through some highlights of our what we do at DHS, as well as of our proposed amended fiscal year 17 and our fiscal year 2018 budget requests that were approved by our board several months ago. So just moving along, I'm on page 3 of the presentation now. I'm not going to go through this. This is our vision, mission, and core values, and I won't go through this in great detail, but I did want to highlight our vision because for us, it is what we ultimately are trying to do every day. It's what we at DHS wake up in the morning and leave every afternoon hoping that we have moved the state forward in building stronger families for a stronger Georgia. DHS, as you know, consists of 3 divisions: the Division of Aging, Child Support, and DFACS. The Division of Aging is designated as the state unit on aging, and it leads and administers the statewide system for senior citizens, individuals with disabilities, their families, and their caregivers. The division designates the division designates planning and service areas under the Older Americans Act and contracts with the 12 area agencies on aging, as well as centers for independent living and other entities to deliver federally and state-funded programs. Our state staff also provide adult protective services and public guardianship case management. And we also administer state plans, including the Aging State Plan, the Alzheimer's State Plan, and the Senior Community Service Employment Program Plan. This division is led by Abby Cox, who's here today. And later today, you will each actually receive an electronic copy of our aging annual report that's called Just the Facts. So I would encourage you to please let us know if you have any questions once you have an opportunity to look at that. Just to share a couple of key highlights for fiscal year 16. In fiscal year 16, we delivered, there were there were 3.9 million meals that were delivered through congregate or home delivery. 91,000 individuals were served through our Aging and Disability Resource Connection, which connects people to our services. One of the key areas that we have focused on this past year has been senior hunger. And back in September, the division hosted Georgia's first ever Senior Hunger Summit, and we pulled together experts and policy members to heighten the awareness of senior hunger here in Georgia. Georgia ranks near the bottom for senior food security here in the United States, and as a result of the summer, we've assembled a group of interested stakeholders to help develop Georgia's first state plan that will help to address senior hunger here. Approximately 3,200 people remain on the wait list for home-delivered meals, with an average wait time of 366 days here in the state. The other division that I'm going to talk to you about is our Division of Child Support Services, which is led by Tangular Gray. Our Child Support Services Division is one of the best in the nation and is extremely highly regarded by both our peers and our federal partners. The division enhances the well-being of children by enforcing their court orders for financial and medical support and provides support to parents. We also do a significant amount of outreach services, including our fatherhood program, the parental accountability courts, and the access and visitation program. And these programs are devoted to helping to improve the economic and other quality of life outcomes for children. Some of the significant activities that this area performs include locating non-custodial parents, confirming paternity, establishing and enforcing child support and medical support orders, and collecting and distributing payments. For fiscal year 16, over 550,000 children were served through child support orders here in the state of Georgia, and we distributed roughly $740 million. There were roughly almost 370,000 parents that were under court order to make child support payments. I mentioned just a moment ago our parental accountability courts. And the Parental Accountability Court program is a joint effort between the department and the Superior Court judges to offer an alternative to incarceration and to help chronic non-payers of child support make regular payment. They utilize community resources and judicial oversight to address barriers that keep parents from meeting their support obligations. PACs are currently operational in 23 judicial circuits across the state. One just came online back at the beginning of December, and there will be another 10 or 9 more added during fiscal year 2017, and there are actually 2 of those are kicking off this week. One of the things that we're very proud of this past year has been the development of our full-service mobile application for child support customers. Georgia is the first in the state to create, an application for child support customers. And it launched back in October of 2016 and has been downloaded more than 30,000 times. Using the app, our customers can make child support payments, view their payment history, view scheduled appointments, and a variety of other things. This has made it very easy for people to make their payments and see where their cases stand without having to actually make a phone call to us or talk to one of our agents, which of course people prefer to do that. And we're really proud of this. This was developed in-house by our Information Technology Division. The next slide highlights the allocation of the FY 2017 appropriation, and I'll just go through that at a very high level. Approximately 78% of our budget went to safety and accountability, which is protecting Georgia's children and families. Another 4.6% went to the vulnerable elderly population. 5.7 is for departmental support. And then we have 3 attached entities, the Council on Aging, Family Connection, and GVRA, which was another 11.6% of funds. Next, I'd like to give you just a brief summary of our amended fiscal year 17 budget request that was approved by our board. The first item is related to, is for departmental administration, and it is additional funds for the IES project, that's the Integrated Eligibility System project, of $10,814,000. IES, also known as the Georgia Gateway, is a one-stop shop for the following programs: SNAP, the Low Income Home Energy Assistance Program, Peach Care, WIC, Medicaid, and Child Care. And it will create a system where a person can apply in one place and be seen whether or not they're eligible for all of those different programs. And so we've been working on this. This was transferred from DCH to DHS about a year ago. And so these additional funds are necessary. They've been identified after the transition, and they're due to a variety of things: time extensions, implementation, rollout, training, the call center. This system is going to go live in this fiscal year, or right into the beginning of the next fiscal year. Our pilot will be going live on February 6th, and that is in Henry County. Henry County is an example of a county that basically has every type of scenario that we deal with is handled through the Henry County office. So we are going to pilot the system there in Henry County, and I've told them to break the system, because if it's going to break, we want it to break when we're doing it in just one place as opposed to when we roll it out throughout the state. We also want to make sure that we won't have any issues when it goes live, system issues or anything. So that's what we'll be doing starting February 6th. And then after that, we will have 2 waves of rollouts throughout the state. Wave 1 will roll out to another 46 counties, and that'll be May 1st, 2017, which allows us time to fix anything that's identified. I don't hope they break the system, but I do hope that they identify things for us to address. And then Wave 2 will be the remaining 112 counties, and that'll go live on July 3rd in 2017. We have in addition, this project has been a partnership of several state agencies, and so I did want to share those, not just DHS. It's also DCH, DCAL, DPH, DFACS, GTA, OPB, as well as federal partners from the Center for Medicare and Medicaid Services, or CMS, and the Department of Health and Human Services. We also have a very robust call center that will be in place, a business readiness team to address constituent as well as staff questions or concerns, as well as significant training and rollout for our staff on this. The other 2 items for amended fiscal year 17 are actually redistributions. We received a grant back a couple of years ago for the Alzheimer's Disease Supportive Services Program, and we were awarded a phase 2 of that grant, and it required a match from us. And so this money is just a request to redistribute it from our departmental administration budget to the Elder Community Living Services Program budget to cover that grant. You'll see part of it here and then part of it in fiscal year 18, because the time frame covers 2 fiscal years, so we just spread it out. The other one, some of you may be familiar with our Forensic Special Initiatives Unit, and this is another request to move funds from the departmental administration budget to the Elder Abuse Investigations and Prevention Program to fund a full-time position in that area, which would give us a total of 3. And this full additional staff person would increase the unit's ability to provide training and to focus on developing some train-the-trainer modules. This area investigates personal care homes and people who have been abused in those, and has been very key in training law enforcement throughout the state to help handle those. And so we just are requesting permission both in amended fiscal year 17 and then also in 18 to transfer those funds. For fiscal year 18, I just wanted to just highlight some of our budget requests there. And those include additional funds related to IES. And I know, and that's another $8.8 million. And IES has been the largest technology project that the state has undertaken. And so it has truly been a partnership with all of the agencies that I mentioned, and we appreciate everybody's hard work on it, as well as your support of this project in the past when it was with DCH and now for DHS. We're also requesting, over the last 3 years, we've received funding to add each year an additional 11 adult protective services workers, and we are asking for another 11 additional personnel for that. And then also we are asking to increase the funds for our non-Medicaid home and community-based services by another $4.2 million. And those are services that include adult daycare, adult health, home-delivered meals, congregate meals, home modifications, personal care. I'm just giving you a few of the things that those monies could be used for. I just wanted to highlight for you the how the number of seniors in the state of Georgia has increased over the last few years. In 2014, it was roughly 1.6 million, and it is estimated for 2017 to be over 1.7. And so, as you can see, there's a significant growth, and that will continue to grow over the next several years out into 2030 is what we projected. The next slide basically just discusses the two redistributions that I mentioned earlier. Again, the grant one is just the second part of it, so that's a one-time move. And then the additional personnel for the Forensic Special Initiatives Unit, this will just make it permanent by moving it in the actual FY18 budget. And so one of the other key initiatives that the department will be doing this year is joining DFACS in its blueprint for change. And so I'm going to turn it over to Director Cagle to discuss the blueprint, since they've already been doing it and been doing such a great job with it, to discuss that as well as to go through the budget as it relates to DFACS, and then we're both available to answer any questions after that.
Thank you very much, Commissioner. Good afternoon. Thank you, Madam Chair and members of the committee. I want to just give you a brief overview of the Blueprint for Change, which is a framework that was developed in 2014 when I came aboard as the director of the division that is being used to guide our reform efforts in both child welfare and family independence programs. It is consistent with the goals and the mission and values of both DFACS and the Department of Human Services, and we're pleased to have DHS join us in this effort. This has evolved not just to be a reform effort framework, but also to be an internal branding effort. We have worked with a national funder that has provided us with assistance in developing this into a branding effort known as I Am the Blueprint. And basically it asks our staff to begin thinking about why they do the work that we do. I think it's essential that as we do this work, because it is so difficult, that we have people that are truly committed to the work and that really have a connection to it. And we ask people to think about how they can be a part of making a stronger Georgia by helping the families and children of the state. We will also in the future be looking at utilizing this as an external branding campaign to help people understand the work that we do and the kind of commitment that it takes to do that work, and also the kind of difficulties that come as inherent in the work that we do. There are three parts to this plan, and I'll just touch on each one of those. The first is robust workforce. I think this is interchangeable almost with any agency that you're going to hear from today. It is incumbent upon us to have a staff that is sufficient in numbers. Just to give you an example of the numbers that we're looking in May of 2014, we had about 55% of the staff that we needed to do child welfare work in this state. Over the last 3 budget cycles, this body, as well as the governor's office, has afforded us 628 additional staff in child welfare. I cannot tell you the difference that has made in both morale and in terms of the quality of the work that we can do. We're now up to about 77% of the staff that we need, and I'll talk with you a little bit more about that in a moment. We're working also to develop mentoring programs for supervisors. What we know from having operated agencies over the past 28 years is that a supervisor can make or break the work that you do. They're the key person in the organization for changing the way that we do the work, making sure that we do the work that we need to be doing. So we're going to be working on that, have begun that in pilot phases across the state. We also have been looking at the tenure of our supervisors. Because we have had a great deal of turnover, we have noticed that we're having some supervisors that are being promoted in child welfare, for instance, that only have a couple of years' experience. I can tell you when I first started 28 years ago, you did not get promoted into a supervisory level position in child welfare with less than 5 years' experience. And that was just recognizing the fact that it is a very complex work that takes time in the position to be able to understand what you're doing. We also are working with the Office of Planning and Budget on the development of a career path for both our child welfare and our family independence program employees, and working on also reduction of turnover issues. We've been working also on the way we practice. What we do with families is really determined by our first contact with them. If they feel as though we're there to assist them, we can do good work. If we approach a family in a way that is offensive to them or is in some way intimidating, we lessen the likelihood that we're going to be able to do effective work with them. So we have begun the institution of solution-based casework, which is a research-based practice model that we're using in our child welfare area. At this point, we've trained 46% of our staff in the state, and we will continue that. We also, as a part of this, will be certifying all of our staff in the use of solution-based casework, and that is a long process. It is a 28-month training and certification process that is well underway at this point. We also reinstituted what we call one caseworker, one family in our family independence programs. In talking with members from around the state early on, we knew that there was a need to reinstitute services within our county offices. We had tried unsuccessfully to implement a system where we did this by call center, and we saw that that was not working. We changed that, and as a result, we've seen some tremendous progress. When I came aboard, we were determining eligibility timely in only 66% of our SNAP or food stamp cases, and that indicated to me that we had 35% of the people that needed this service that were not receiving it. And food being such an essential service, that is something where we cannot fail. As of today, we're performing at 96 to 97% timeliness, and we're very proud to have turned that program around to the extent that the federal government has taken us off of what was called an advance warning. You may recall 3 years ago when there was a news article that came out in the AJC that said that the U.S. Department of Agriculture had put us on a warning of $76 million potential penalty in state funds. We received the word before Christmas that we've been taken off that warning and are no longer in danger of having that penalty imposed. We also are doing a lot of constituent engagement work, and we have just completed a full round of the state. And as I'm looking at this panel, I'm seeing many of the people that I've engaged around the state and had dinner with to talk about the plans that we have. That's something that we will continue. We truly believe, Commissioner Crittenden agrees, that this work is only done effectively when we're doing it in concert with local communities and the leaders that we have throughout the state. I'm going to talk about the primarily child welfare going forward, but I'm very pleased to answer any kind of questions you have about our family independence programs as well. This next slide is about caseloads and DFACs, and this is the child welfare caseloads. You'll see that we keep a very close eye on the average caseloads, but I also have additional questions because I know from having run county departments that if you look at average caseloads, it can be deceptive. And what I knew to be the case is that when you have an average caseload of 19 cases per caseworker, that is 19 cases per caseworker if you have each and every position filled. You can look there at your specific regions around the state. The number at the top, right under the region number, is the actual caseload averages, and those are for those caseload that have a caseworker in that position. The number below that is the number of cases that would be being handled by that average caseworker if we had every one of those filled. And the turnover issue is one that is causing us to have a big gap in those two numbers. The latest is about 32% turnover, and we fluctuate on a monthly basis between 32 and 36% turnover, so basically turning over 1 in 3 of our staff on an annual basis. The pay here is about $28,000 a year for an average caseworker starting out. That's a bachelor's level caseworker. I was very appreciative of Representative Kirby's question because we have been looking at this as well. We're approximately $10,000 below where we need to be competitive in this area. We pay our master's level social workers about $34,000 a year, need to be paying them about $45,000 a year to be competitive. You'll see that we received 148,000 plus reports of child abuse and neglect last year, and that is a approximately 80% increase over 2013. Part of that is due to the fact that I think we're in the throes of a drug crisis in this state. And the other part of that is that we instituted a 24-hour-a-day, 7-day-a-week call center, which I think was exactly the right thing to do because it gives the public the opportunity to call when they have the time. Not everybody can step away from their job to call about a child during the regular business hours. On the next slide, you'll see that at top of mind for us also is the number of children that we have in out-of-home care. Currently, we have about 13,000 children in the custody of the Department of Family and Children Services, and we have seen a steady increase in that. With that, we have seen a real challenge in the development of resources for this, in the number of foster homes that we have, and in particular in having enough foster homes in the areas where we need the foster homes. You'll notice, for instance, Regions 3 and 14 are the two areas where we have the highest needs. Region 3, Chairman Dempsey, is your area, and you and I have worked on this very intensively. Those are the areas that are having the most challenges with the number of kids coming into care. It's not that we're not recruiting enough foster parents, it's that we're not having, or that we're having too many kids come into care that's outstripping the resources. To deal with that, we're looking at increased recruitment. We're doing multimedia campaigns to recruit foster parents. We're also increasing the use of relative foster care, believing, as research says, that the best place for a kid, if they can't be with their family, is to be with a relative because it's less traumatic to the child. We also know that the ability to work with families to keep children safe in their home, it also has to be a part of that equation. Now, moving on to the budget request summaries, and this is a very short presentation because there are only two items that we're talking about here that were approved by the DHS board as per our request. This, again, is a demonstration of the number of kids that are coming into care. This has been growing at a clip of about 16.5% a year, and we're hopeful that we're seeing a small decrease in that percentage. And you'll see on the next page, in order to maintain just the number of kids that we have in care for the remainder of this year, we're requesting in excess of $21 million to cover the cost of that out-of-home care. Those are, again, I will stress, just to maintain the children that we currently have in care. If you'll look at the next page for FY18, you'll see that we're projecting still an increase there with an additional $29 million needed in order to be able to complete that fiscal year. We are being optimistic in that. There is a potential for us to go beyond that need and ask for an adjustment in the FY18 budget. And at this point, I think we'll be available to answer any questions, Madam Chair.
Thank you. Thank you. Great information for us to have. Okay, our first question, Representative Oliver.
I want to congratulate y'all on the transition, not the ending of the Kenny A case. I think that's good work. And on this improvement y'all have made on the eligibility. You're spending $20 million just by these rough numbers, and I'm sure you're spending a great deal more than that, but avoiding that eligibility penalty is huge.
Absolutely. Thank you.
The call center was the right idea, and I am not as troubled as some by the increase of abuse reports, because I don't think we were ever coming close to identifying abused. But I've never seen a budget where you're not asking for caseworkers, and I am pretty troubled by this highlighted budget here that is only focused on an extremely narrow part of the challenges you're facing.
Thank you, Representative Oliver, and I can tell you that we've had ongoing discussions with the Governor's Office and Office of Planning and Budget regarding the needs around this. Our focus has really been to talk with them about the turnover issues that we have. We're looking at a vacancy rate that is so high that if we could resolve the vacancy rate, it would be the equivalent of adding about 500 caseworkers. And so we have continued to work with the Governor's Office around that. I am hopeful that you may see something in the Governor's budget to address that issue.
That makes me feel a little better, because I was pretty concerned about that gap here.
Yes. Thank you.
Two smaller issues. You and I have had conversations about what I consider the legal challenges, let's use that word, of the Children's Trust Fund as it exists right now.
Yes.
We are collecting money on a constitutional amendment that was approved. We are not managing it according to the constitutional amendment. And you additionally have a federal obligation to prevent child abuse, and I don't know how you're doing that. I don't see how that's... I don't see how that's stand up in court right now.
I'm sorry, yes, we do have a Office of Prevention and Family Support that operates utilizing not the funds that you're referencing, but Promoting Safe and Stable Families funds and some of the funds that were allocated previously to the Governor's Office of Children and Families. I think that's an issue beyond that, the Children's Trust Fund that...
Where does the Children's Trust Fund designated funds go?
It is not within our budget, Representative Oliver, and I would think that that's probably something that you would need to address with the Office of Planning and Budget.
It's a legal morass at best.
That is my understanding, yes.
Final one, small issue. I sent to y'all an eligibility issue in relation to eligibility for TANF funds on the other relative capacity to apply for benefits. Seems to be a gap in the law right now, and I want you to help me look at that and see if I'm right about that.
Yes, we are looking at that at first blush, and we're continuing to do the research behind this. We think that it may be a problem in the federal eligibility rules. We will continue to look at that and keep you updated.
I think it's the state statute problem, but I appreciate your guidance on it.
Absolutely.
Representative Taylor.
Yeah, back to Ms. Crittenden for 1 second. On page 5, looking at the DAS initiative highlights, the number there, 3,200 people remain on the wait list, but the average is just a day over a year to remain on that wait list. Just because I don't know the answer to this, can you give me an overview? Do you deal with like nonprofits or food banks or public-private partnership, even volunteer groups like churches to provide part of those services?
Yeah, excuse me, yes, we do. These funds are actually the funds that we do this program with, we actually distribute through the 12 area agencies on aging, and they work with a variety of groups to provide meals and to do resources. That was one of the very good things about the summit that we had, because we brought together people from the food bank, people from Meals on Wheels, retailers, several different groups to try and talk about this, to talk about senior hunger. So yes.
Thank you. If I follow up one more. If I can follow up one more.
Oh, yes.
Yeah, just a comment on that. I've worked with some of this. My wife runs a nonprofit with more international food stuff. But the biggest thing that we see a lot of times is folks that you have actually some of these organizations working against one another because there's a lack of coordination, and you have, say, a church here and a church here and a food bank here that don't know that each other exists, and so you end up with a do you foresee any the summit I get, but do you see any sort of what I want to call a clearinghouse for this sort of stuff?
I think that'll be something that we'll be taking a look at this next year as part of the state plan, and making sure that people are aware of who in their communities are providing different services, and to see if we can create more collaboration. This is not a problem that is just going to be solved by the state with state funds. It's a much larger problem, and so that's one of the reasons that we wanted to convene that group.
Thank you.
Thank you.
Madam Chair, if I could also add to that, the Division of Family and Children's Services, using TANF funds, also invests about $7.5 million a year in food banks around the state.
Great, great. Representative Broderick.
Yeah. Director Cagle, this is a question for you. I've got some constituents. This is in regard to your program for your foster children, EPAC,
Yes.
about execution of contracts. They receive them in the late spring, and then as late as October, they still have not been executed or signed off on. I've got two constituents that are providers that they were told to continue to provide services even without a valid contract.
That's very concerning, and I would definitely like to get the names of those individuals so I can look into that.
I've gone up and down the ladder with them, and they're covered now. They've got their contracts. I think the contracts went out maybe in April, and on October 1st they still were not executed. They sat on somebody's desk all summer.
That is very concerning, and I'll talk with you after the hearing if you'd like, and we can look further into that.
Okay, thank you.
Great. Representative Benton.
Thank you, Madam Chair. To Director Cagle, first of all, I'd like to thank you publicly for all your help on one of the cases in my district that you got involved personally, and that case has been resolved, and it has worked out for the betterment of the child, and I wanted to thank you for that. I wanted to echo Representative Oliver's concern about the lack of new caseworkers in the budget, and I understand about money and everything else. Do we have enough people coming out of college with a degree to fill a lot of the vacancies, or is there a shortage of these types of workers, and is it the money, or is it the caseload, or is it both that causes these people to drop out?
So let me address first the adequacy of the applicant pools.
Okay.
I think we are running up to the point where we're going to be seeing challenges in getting qualified caseworkers if we don't do something to increase the number of graduates coming from our schools of social work. And to that end, we have been working with 9 of the schools around the state to invest additional federal funds, Title IV funds, in paying for the degrees of those individuals with an agreement that they will work for us for a year for each year that we pay for. That is has been very successful. We need to expand that program and are looking currently at how we can do that. And I apologize, Representative Benton, the second part of your question, if you'd repeat that, please.
Was that the reason that you have such a turnover rate? Is it because of the money? Is it because of the caseload, or is it a combination of both things?
We survey on this, and what we know is it's a combination. The money is actually probably the second or third factor that gets named. I can tell you from having been a frontline caseworker that the primary issue for me was the stress of the job, and high caseloads in a good environment where you have a caseload of 15 or under. It is a very stressful job. But when you start getting into the 20-25 case range, what happens is you begin to lose sleep if you care about the job that you do, because you can't do an adequate job. You can't see the children as often as you'd like. And it just ends up wearing you out before it's over with. So the combination of the difficulty of the job, the caseload problems that we have, and the money, I think are the three factors that really culminate to give us a 32 to 37% turnover rate.
Can I have a follow-up, Madam Chair? When you place a child, what is your percentage of foster parents that are relatives of that child?
We have actually increased that. We're at, if I'm not mistaken, Cliff, we're 27%.
Relative placements would be about that,
Yeah, 27% of all placements right now. It has been a goal of mine to increase that considerably. I've charged my staff with getting that to 50% by 2018. Since 2014, we've increased from 17 to 27%. So that is something that is top of mind for me, because I think it is the best for the child if you can find a relative who is going to provide a safe place for them, because it is so much less traumatic than going to a complete stranger's home. Regardless how loving the stranger is, it's still a stranger.
Okay. Thank you, Madam Chair.
Thank you. Representative Kirby.
Thank you, Madam Chair. You just had something, Director Cagle. I think the idea of paying for some school and exchange is great. My daughter's got her MSW, and if you want to make that retro, I'm sure she'd appreciate it. So, but I don't know if you'll get her out of Ohio unless you have a job for the boyfriend. So, but Commissioner Crittenden, as an HR professional, I've talked to your office quite a bit, and some to you. Child support, medical support orders. As I tell my employees, I speak government better than most, and it's still a maze. When it goes south, is there anything being done to kind of help that process? Because we've just had too many phone calls where we're doing the deduction, we're sending the money in, and they're still getting contacted. What are you doing to help improve that?
I'm going to ask Director Gray if she would comment on that, because we are making some changes to that process, and she can give you more detail.
My name is Tangela Gray. I'm the director for the Georgia Division of Child Support Services. I wanted to respond to your question around the medical support order process. Mm-hmm. We do have some federal requirements as it relates to the child support order itself. However, the Federal Office of Child Support Enforcement has provided us with some additional opportunities to handle that process electronically. And by doing so, it provides us with the opportunity to reduce the number of times we contact the employer. We have implemented the process. It was implemented in October of 2015. It's referred to as an electronic income withholding order process, and it will provide us with an opportunity to communicate with employers through our system, reduces the paperwork, reduces the phone calls, and increases the coverage that's provided to the customers.
Follow up. Sure. As part of that process, is there such a thing or can you implement something that would allow my employees to give me authorization to talk for them? I mean, that's one of the biggest things. I've got a third shift employee. It's 2:00 in the morning. They're calling me at home because of these problems, or they got to come back to the office. If they could fill out something, get it to you where I could handle these situations, it would sure make our life a whole lot easier.
Okay, well, based on confidentiality rules and regulations, the customer, either the parent court-ordered to pay child support or the parent that's receiving child support would complete a one-page document authorizing another person to speak on their behalf. So we would have to have that document.
Is that document online where they can get it easily?
We can provide you with a copy of that document.
All right, thank you.
Okay, I don't see any other questions, so Thank you so much. I'm sure that we'll have more questions as we go through the process.
Thank you.
Thank you.
Okay, next up, Georgia Vocational Rehab, Director Casey. I'm so pleased that we have so many other representatives that are joining us today too, besides our committee. That means a lot. I know that y'all all know this is high on the radar of everyone in the communities where we serve. So, well, thank you. If you would take just a minute and introduce yourself to us because you're new
Yes, ma'am.
in the role.
First off, Madam Chair, members of the committee, good afternoon. My name is Sean Casey. I am the new Executive Director for GVRA, Georgia Vocational Rehabilitation Agency. Also, I brought up here our CFO, Minerva Nixon. If there are any detailed questions that I cannot answer, she will be here to assist. Really what I'd like to do this afternoon is, first off, just very briefly kind of explain my background and why I'm sitting in front of you today. I want to talk about the 5 statutory programs that we administer. I want to take a step back and look at the organization as a whole, so we're all singing off that same sheet of music, and then get into the numbers. I do note the time. I will be as efficient and effective as possible.
You take your time to make sure we learn all that we need to.
Yes, ma'am. Thank you. Very quickly, again, I've been on the job for maybe about 2 months now. The reason for this is with GVRA, there is a 9-member board that helps oversee the organization, helps oversee the executive director. When the old executive director was leaving, the board made a recommendation to the governor's office. I was that recommendation. The governor's office reached out to me. I spoke to my wife. I got back to the governor's office, and now I'm here today. Well, you know, as she says, I'm not the sharpest knife in the drawer, but I'm no dummy. I would like to first off get into the programs, the 5 statutory programs that we oversee at GVRA. Real quickly, I'll go over the 5 and then get into details. First, we have the vocational rehabilitation. Second, we have Roosevelt Warm Springs and also Cave Springs. Third, we have BEP, which is the Business Enterprise Program. We also have GIB, which is the Georgia Industries for the Blind. And finally, DAS, which is the Disability Adjudication Services, which is Social Security. What I do want to talk about, I do want to take that quick step back, like I mentioned, and with our footprint, we are statewide. We have 40 offices located throughout the entire state. We have roughly just a hair over 1,400 employees. We have the 5 statutory programs, which I'll get into in more detail in a second. Also, federally mandated transition services, which is PETS for short, is we are reaching into middle and high school students now as young as ages 14. Now I want to talk about vocational rehabilitation. With vocational rehabilitation, provides Georgians with disabilities with statewide access to resourcing, including assessments for services, development for an individual plan for employment, assistive work technology, referrals for training, accommodation assessments and fulfillments, and then job placements and plans for supported employment. Next program I'd like to discuss is Roosevelt Warm Springs, which actually I was visiting a couple weeks ago, spent 9 hours there, and if any of you have not made a trip down there, I would highly, highly recommend it. Roosevelt Warm Springs, obviously historical with President Roosevelt. It's a residential facility that provides the following services: independent living skills, technical certifications, a GED program, assessment for services, development for an individualized plan for employment, assistive work technology, referrals for training, accommodations assessments and fulfillments, and then finally, job placements and plans for supported employment. Now, I do want to talk about the technical certifications and training offered at Roosevelt Warm Springs. CNA or nursing, forklift and heavy machinery, low voltage wiring, residential wiring, robotics, CNC computer, numeric, Microsoft Suite, customer service, business and information technology, horticulture, legal, clerical, 3D design, internet and core computing, hospitality, driver's education, and printing. With that printing, we are actually doing some pretty exciting stuff with 3D printing at Roosevelt Warm Springs. Now, with Cave Springs, residential campus located in North Georgia, the focus largely on workforce development, providing students with the following services. We have evaluation and assessments, employment readiness, post-secondary training and support, life skills, driver education, and personal and social adjustment. Moving on, we have the BEP, which is the Business Enterprise Program. This program provides entrepreneur opportunities for qualified individuals to become licensed blind vendors so they may independently operate various food services and vending operations throughout the state. Among the state's 38 BE locations are all vending at federally mandated interstate welcome centers, several large cafeterias at Georgia military installations, Fort Benning being, I think, the largest one, and various snack bars at state and Georgia facilities, including the Capitol on the main floor. GIB, Georgia Industries for the Blind. Now, GIB is a partner with the National Industries for the Blind that operates 3 manufacturing facilities, all which are wholly independent of state funds. More than 70% of GIB employees are either legally blind or have low vision. Now, the products they are producing are binders and binding supplies, calendars, planners, personal organizers, carrying cases, cutting, measuring devices, envelopes. You can see the list right there, and I believe you all have copies, pillows, and many more. And then finally, we have DAS. DAS makes Social Security disability determinations under an agreement with Social Security Administration. DAS is fully federally funded. Fully federally funded. Our main office is in Stone Mountain. We have branches located in Athens, Dalton, Thomasville, and Savannah. That is a quick snapshot of GBRA and the programs we're administrating. Now, the final slide will be Amended 17, and those are being handed out to you now. And it is flat. We do not have any requests, and I will review that with you now. If it comes up, oh, here's my copy. First, administrative programs, state funds requested are 1.2, almost 1.3 million, well, $1,287,509. With the federal funds we're able to draw down, the total funds would be $12,289,869. Yep. For the VR program, we've requested $15.6 million to support our vocational rehabilitation programs, which also encompass our 40 offices statewide. Now, with this request, it is a 4-to-1 federal match. So with these dollars, we're able to draw down a total of $66.7 million from the federal government to help support our vocational rehabilitation program, which adds up to a total funds of $82,383,000 $1,395. Now, on the slide that you have in front of you, RWS is Roosevelt Warm Springs. The state funds requested is $3,882,583 with Roosevelt Warm Springs. With the federal funds, we're able to draw down the total funds available to Roosevelt Warm Springs. The clients there would be $17,869,000 or $869,476. BEP, the state funds requested are $286,000, or a little over $286,000. With the federal drawdown, you're looking at just a hair over $3.2 million. Again, the GIB and the DAS, there is no state funds there. CS would be Cave Springs. The ask is, again, there is no ask, I should say. Correct myself. It's $276,000. With the federal drawdown, you're looking at $1,841,853. Now, you will see on the, I guess, second to last, Roosevelt Warm Springs Hospital Program, that $1.6 million will be taken out for amended fiscal year 17. This is an agreement that we have with Augusta University, but we would like, the request will be to keep in for fiscal year 18. But for amended 17, that will be removed. Total state funds, $22,996,755. When you add up all the federal drawdown money we're able to receive, you're looking at just a little over $204 million, $204,128,310. And like I said, I wanted to keep this simple. I wanted to keep this short. And at this time, I'd be happy to answer any and all questions that anyone has.
You did just that. You kept it simple, but for a very complicated amount of work, I know. So thank you so much. The work that y'all do to make sure to attain all of those federal matches is so very important, because it's one thing if they exist, it's another if you actually can capture them. So thank you.
Correct.
Representative Oliver.
Not right now, but necessarily right now, but at your convenience, I'd like an update on this transition of the hospital to Regents and the remaining VR programs at Warm Springs. The committee did a lot of work on that a couple of years ago, and someday I'd like to have an update on how that's working.
We'll gather the information, reach out to your office, and schedule a meeting as quickly as possible.
How much money would the state have to put forward as a match to obtain the maximum federal pull down? I know we're, quote, leaving money on the table. I just wanted some suggestion of how much that is.
Well, typically, thank you. My name is Minerva Nixon, as Sean mentioned. On a regular basis, the federal government will award Georgia somewhere $100 million upward. We can only use those funds if we're able to provide the match. We've in the past only been able to match maybe up to 60, close to $70 million of those funds. And so we typically leave maybe about 30, 40 on the table.
So if we appropriated, hypothetically, another $10 million, we would get $40 million back?
Correct. We could match more. That would provide additional match.
Do you have a waiting list right now?
Excuse me, a waiting list?
Mm-hmm.
On?
For people asking for services?
I'm not exactly sure.
That answer is yes.
Yes, I thought it was.
Yes. The number, I do not have the number off the top of my head, but the answer is yes.
Thank you.
Sean, if I can correct that, we don't have a waiting list for individuals on services as we can currently supply the individuals who have. I can't hear you.
Currently, we have a waiting list for Roosevelt Warm Springs. We can't accommodate all of the children that are being referred to that services. I shouldn't call them children. They're young adults.
Right.
However, for our general client services, our general VR program, we are currently able to meet the need. That may change in the future as we're reaching into the transition age populations. It also may change in the future as we try to expand our outreach and let more people in Georgia know what services we have that are available for their use. But currently we are able to meet the VR need, so to speak.
We don't need to spend more time on this, Ms. Chairman, but I know there's the gap between the application process and the actual delivery of services. That's a different kind of waiting list, and that's something I've tried to understand and track, but thank you.
Representative Henson.
Thank you. Just a quick question. You pointed out that your main office for the disabilities adjudication services is in Stone Mountain.
Yes, ma'am.
Where?
Well, actually, it's a stone throw from Stone Mountain. I want to say just a couple miles away from the mountain itself. I couldn't give you the exact address. I have not visited that office. I will tell you that over the last 7 to 8 weeks, I visited almost half of our offices throughout the state.
Is it affiliated with someone else?
No,
I mean, like
no.
Fodak or anything?
I don't think it's a cohabitated facility. No, it's not shared with anybody, if that's what you're asking.
Okay. Could you get me the address, please?
Yes, ma'am.
Thank you.
Okay, I don't see any more questions at this time, but I do know that we have the unique situation with Warm Springs. And because we're getting ready to go into session, that makes it a little hard for us to journey there, but I do hope after session to bring the committee and to try to better understand the relationship, because there's sort of multiple things going on there, I would say, and particularly with Augusta University now too. Very important program. So why don't we do this too? If y'all are able to put together another session, it doesn't have to be a big called meeting, and just, I know Representative Oliver was interested in it, but what if we work through Representative Oliver and myself, and let's see if we can put word out to any of the other members that might like to do it, and we'll just try to do it an afternoon soon. After session one day, just a conversation, just to help us kind of come up to speed on it.
Well, what I would suggestion I would make is, I forget the exact date, but there will be a graduation ceremony at Roosevelt Warm Springs. Go to Lord Whaling after session is completed this spring, hopefully March. And I think that would be maybe a great opportunity to get a couple birds with one stone.
Certainly.
Because I know last graduation was a month ago, and with that group, I believe the number is 51% had a position, had a job upon graduation, which
great.
is, I think, a fantastic statistic. So we might be able to we can do that, we can accommodate you, and I think a good opportunity would be during that graduation. I think it's May or June. But we can work with your offices.
We'll work toward that for sure. And in the meantime, while we're going through the budget process right now, I think it'd be good for us just to have some conversational time for those who are available, and we can make it one effort on your part so you don't have to meet with each of us individually.
Fair enough. Thank you.
Thank you. Thank you so much. And hope it's a very good new year for you especially.
It's going to be a big year. Big year. Thank you.
Thank you.
Okay, and for those who've been waiting very, very patiently, thank you so much. Commissioner Roby, if you would come give us an update.
Madam Chair and board members, thank you. Happy New Year's. I'm Mike Roby, Commissioner of the Veteran Service for the state of Georgia. It is a pleasure for us to be with you today to discuss how the Georgia Department of Veteran Service operates and summarization of our agency's budget request for the amended FY17 and fiscal year 2018. With me today, to my right, is Assistant Commissioner Dan Holtz, who's over our administration, health, and memorials. Behind me is Assistant Commissioner George Canavaggio, over our field operations and our appeals. Our operations director, Mark Bannister, and our budget analyst, Miss April Dodgen. We provided you with a packet, and inside that packet is some literature and a copy of the briefing. In federal fiscal year 15, the VA paid to the veterans of Georgia $3.1 billion in compensation and pension benefits. These benefits are tax-free to the veterans, and the money is spent in Georgia purchasing goods and services and paying state and local taxes for sales and properties, etc. According to the Atlanta VA Regional Office, 68% of the payment, which equaled $2.1 billion, were handled by the Georgia Department of Veterans Service. In addition, the VA paid $5.8 million in education and vocation rehabilitation / employment benefits in Georgia. Again, these are tax-free benefits. Page 2 of our briefing slide depicts 3 missions of our department. Our primary mission is to assist Georgia veterans, their spouses, dependents, and widows seeking earned benefits from the VA and from the state of Georgia. This also includes active duty personnel who are eligible for some benefits, such as home loans, state licenses and passes, etc. There is a saying, which is very true: no benefit is automatically provided. You must apply for it to get it. That is what we do. We assist the veterans in applying for their earned benefits. Our next mission is to provide skilled nursing home care to our war veterans at our 2 state war veterans homes in Augusta and Milledgeville. The home in Augusta is operated for us by the Medical College of Georgia University, and it serves as a laboratory for residents and interns in geriatric medicine. The home in Milledgeville has been operated for us since fiscal year 1997 by a contractor, which is currently United Veteran Services of Norcross. Our third mission is to provide perpetual care for deceased veterans, their spouses, and authorized dependents at our 2 state veteran cemeteries in Glenville and Milledgeville. Page 3 depicts our mission: to provide high-quality assistance to our veteran clients, to provide high-quality skilled nursing home care to our veteran patients, to provide VA shrine level services at our cemeteries, and to provide high-quality customer service and ensure our customers receive priority in all their dealings with our department. Page number 4 depicts our values. We value Georgia's veterans and their services they provided to our nation and to our great state. We value the ongoing relationships we have with the VA to assist and serve our state's veterans. We value the partnerships we have with the many veteran service organizations in the state, such as the American Legion, the Disabled American Veterans, the Veterans of Foreign Wars, our Military Officers Association of America, etc. And we value our staff members who assist Georgia's veterans. Page number 5 of the slide depicts how we are organized to accomplish our mission. We have 52 field offices across the state, from Dalton in the northwest to St. Mary's in the southeast. In addition, we visit 25 locations periodically to assist veterans in smaller communities. The benefit claims process usually begins in our field offices. Our appeals division assists veterans with appeals of the VA claims issued and decisions to try to assist veterans in getting the best deal for their compensation or pension claims. I mentioned earlier our 2 state war veteran nursing homes and our 2 state veteran cemeteries. Our Veterans Education and Training Division serves as the VA state approving agency for all education and training supported by the GI Bill. We perform this function under an annual contract with the VA to approve training programs, apprenticeships, and on-the-job training in Georgia. In addition, we monitor the VA, the training provided by these two providers, and the education provided by public and private institutions of higher learning, such as colleges and universities, technical colleges, and junior colleges. We have the authority to recommend to the VA the suspension of institutions and programs where deficiencies are noted that are negatively impacting the quality and quantity of education and training provided to enrolled veterans. On page 6 and 7 depict some of the key activities and events our department participates in each year. In October of each year, the governor proclaims November the 11th as Veterans Day in Georgia. This event is well attended by veterans and veteran service organizations from across the state. Our department leads the Returning Veterans Task Force, which is currently made up of 15 state agencies to coordinate state efforts to assist veterans coming to live and work in our state to ensure a seamless as possible transition to civilian life. Over the past 4 years, we have been very actively involved in the commemoration of the 50th anniversary of the Vietnam War to recognize and thank this generation of service members for their service to our nation during that turbulent period of our nation's history. With Governor Deal's approval, the state is issuing certificates of honor that have been presented to Vietnam War era veterans in over 240 ceremonies. Many members of the General Assembly have participated in these ceremonies, and the veterans receiving that certificate and the DO Vietnam Veteran War Pin have all been extremely appreciative. It is never too late to say thank you for your service to our nation. We maintain a visible presence to the veterans in the state through our state benefits handbook and veterans-related events calendar, as well as our website, Facebook, and Twitter messages. The goal is to keep our veterans informed of their earned benefits. Page 7 continues the list. We work with other agencies on veterans issues that tend to recognize and thank the veteran for their service. Many of our staff members from our field offices up to our central office make periodic speaking engagements to talk about veterans benefits and veterans issues. Again, working to keep our veterans informed. The Floyd Veterans Memorial Building and the Pete Wheeler Plaza at its front has become the state site for many state memorials recognizing and remembering Georgia's veterans. In conjunction with the Georgia Building Authority, we oversee these memorials and assist in adding new ones over time. For the past 3 years, we have been working on establishing a subacute rehabilitation therapy unit at our Veterans War Home in Milledgeville. The 60-bed unit will provide rehabilitation care and treatment for veterans dealing with post-traumatic stress disorder, traumatic brain injury, and multiple amputations. The care to be provided will go beyond the care the VA is able to provide at their hospitals and clinics due to space limitations. The total project cost is $12,360,000 in renovations and upgrades to the Russell and Vincent buildings at the home. $6 million in matching funds from the VA. $6 million from the state, where the first $3 million in general obligation bonds were approved in the FY17 appropriations, and the remaining $3 million in bonds needs to be approved for FY 2018. Lastly, we provide annual training for our field service officers and our claims and appeals officers to ensure that they are equipped with the most current information to assist veterans with their claims and appeals to the VA. Page 8 depicts our budget request for the amended FY 2017 budget. The guidance from the Governor's Office of Planning and Budget was for agencies to plan for a flat budget for both FYs 2017 and 18. Our budget request for the amended FY 17 budget conforms to the Governor's guidance. Likewise, on page 9, we are showing a flat budget request for FY 2018, which was submitted through the budget tool process. However, for FY 2018, we also submitted an over $1.9 million in offline requests to better support operations for our department. These offline requests are detailed on pages 9 through 16, and I will briefly summarize them. On page 10, the first two items reflect the correction of a calculation error that occurred in the FY 2017 appropriations related to the 3% pay and adjustment for department employees. In the middle of August 2016, we became aware of this error that affected two of our physical programs, totaling a funding shortfall of $134,800. These two programs affected were the Benefits Veterans Program for $119,531 and the Cemetery Program for $15,269. Because the FY 2017 budget was already 6 weeks old and pay adjustments had been made and implemented, we elected to defer the correction of the error until the FY 2018 budget. The correction due to the error will enable the department to provide further adjustments to pay for the employees in these physical programs to bring their closer to the mid-market average of their respective wage grade, to aid in recruitment and retention of our staff members. We consider this correction a must-pay for the department and seek your full support of it. Over the last 8 years, pay raises for long-term employees and managerial staff have been frozen or extremely limited. At the request of the Veterans Service Board, we undertook a study of our field office managers and long-term staff members and determined they were being paid considerably less than contemporaries working for the VA. To recognize we will not be able to fully compete with the VA for salaries, but we need to make some adjustments to try to stem the tide of many of our brightest and youngest jumping ship to the VA and other higher paying employees. We proposed a 4% pay adjustment for these staff members and have requested the funding to support the adjustment in our pay for these 67 personnel. On page 11, the first two items relate to a request for a 5% pay adjustment for our cemetery and veterans benefits personnel. Representative Frazier, as you commented earlier, sir, we conducted a survey through the National Association of the State Directors of the VA of what other states were paying their employees. What we found was Georgia is consistently paying less than the other states for work being done in similar situations. As recently as the last week in December, we became aware of the Disabled American Veterans, the DAV, has provided a $10,000 per year pay raise for their service officers around the country. It is too early to know what impact this may have on some of our employees who may seek to work for the DAV or other service organizations in order to earn more money. We are asking for a 5% pay raise adjustment for these two programs so we can bring our employees up to or closer to the market average wage grade salaries for their respective jobs. We look at this as a one-time elevator adjustment to level the playing field. The next item on page 11 is the establishment of additional or expanded field offices. Page 12 depicts the proposed locations and the number of additional staff members needed to operate in these new or expanded facilities. The locations are all in the higher populated areas of the state and would enable us to better serve over 175,000 veterans who now have to travel long distances or in congested traffic to receive assistance on their claims. Not only will these actions ease the process for veterans, we anticipate we will be increasing the workload of our department significantly by being able to reach out to more veterans needing our service. Where possible, we are trying to co-locate our offices in VA outpatient clinics and at VA medical centers. However, it is not always possible to achieve that, so the standalone department offices are still needed. We have co-located our field offices with other state agencies where we can. For example, we are using space in the Georgia Department of Labor offices in Coffee County. Also, we are sharing space with some other agencies in Columbus. We are looking to expand our office in the Atlanta VA regional, the Atlanta VA Medical Center from 3 persons to 5 persons to handle the increased workload at that location. We are looking to expand our office in Columbus to accommodate the increase in workload we have experienced since the U.S. Army increased the active duty personnel at Fort Benning several years back with the merger of the infantry and armor training facilities. We have projected the need for 13 additional staff members to support these new and expanded office locations. On page 13, we have depicted our request to have a department training function to support annual and ongoing training requirements be imposed by the VA and by the several veteran service organizations we represent. Currently, our training is conducted by our staff members from our appeals division, but increased appellant workload is making this method very difficult. We have proposed a staff of 2 individuals to perform this work. They will be responsible for the annual training and will develop monthly webinars and other training media to support ongoing training requirements that cannot or shall not wait for the annual training event. We have also proposed to establish a women's veterans office staffed with 1 individual who would be highly trained in dealing with issues affecting women veterans. This position will be located at the department's central office and provide support across the state in dealing with individual and group women veterans issues and assisting field offices with these issues. Examples are pregnancy, military sexual trauma, articulation of disabilities affecting women to facilitate their ability to file claims with the VA for earned benefits. At the recommendation of the governor's office, we have included requirements for both of these functions, training and women's office, to provide assistance to Veterans Treatment Accountability Courts across the state in recruiting and retraining mentors who will be working with veterans coming before these courts for justice. Mentors are important functions in these veterans courts, and we hope our personnel will be able to assist in getting top-notch volunteers to do the mentoring. On page 14, we are showing our request for funding for a second vehicle for the department. The vehicle will be leased and provide support to the statewide activities we perform. The department currently has 1 minivan assigned to the central office that is 10 years old. While it is presently in good shape, it supports a number of tasks across the state involving senior department staff, our IT personnel, administration, distribution, runs between the central office and the Atlanta VA regional office, etc. We are requesting funds to replace 25% of our IT equipment on an annual basis. Our staff members in the field offices and at the appeals division need to maintain access to the most current information on VA's rules and regulations, court decisions, etc., in order to provide the best advice available to our veteran clients. The best guide to do this is through the LexisNexis manuals and in both printed and CD format. The $37,070 requested will provide that capability. On page 15, we are requesting funding to fully implement telephone conferencing for the department to be used for training, business, board meetings, etc. Several years ago, we consolidated several pamphlets into a state benefit book that is modeled after the federal benefits book published by the VA. It has been a bestseller. We update it annually to maintain currency with new state laws and new procedures related to the various benefits available to veterans in Georgia. While we have it online at our website, the hard copy version remains in high demand. The VA has been publishing the federal veterans booklet for many years. Historically, we have been able to obtain them at no cost through the VA Atlanta Regional Office. However, that source has now dried up, and we need to purchase them through the government printing office. Like the state books, the federal books are available online. However, the hard copy version remains in very high demand. Lastly, on this page is our request to fund the continued publication of our veterans-oriented calendars, rack cards, and other media. The operation of the department needs to inform our Georgia veterans of their earned benefits and how to obtain them. On page 16, we requested funding support for our electronic claims processing system that is related to the number of users increasing. The annual cost per user is $399 per year, has remained unchanged. However, the number of individuals using the system has increased over time and is expected to increase even more with the addition of our expansion of offices across the state. As I mentioned earlier, we provide service to 25 satellite offices across the state. These offices are supported by nearby field offices whose staff members supporting the satellites must travel to them and back. We must pay the travel expenses associated with these itinerant visits, roughly $22,000. The VA now requires all personnel having access to their IT systems to have a personal identification verification card called a PIV, P-I-V. To obtain them, our employees must pass a federal national agency check with investigation, NAC 1, must be fingerprinted at a VA facility, and obtain a photo from a VA facility. The card must be reissued every 2 years, and the trips to the VA facilities to obtain the reissuance of the cards will occur every time for every employee who has one. To accomplish all that our employees must travel at least 3 times to a VA facility. We must pay the travel expense associated with the PIF card requirements, which is roughly $20,000. Page 17 concludes this briefing. We have included the names of several of our key staff members for your information. At this time, we'd be pleased to take any questions that you may have. Thank you, Madam Chairman.
Thank you. Very good bit of information for us to look at. We've got a couple
Yes,
of questions
Yes, ma'am.
lined up here.
Yes, ma'am.
Let's start with Representative Oliver.
Yes, ma'am.
You gave us the name of the contractor for the Milledgeville nursing home. Is that the Pruitt facility, or have you?
Yes, ma'am.
Is
it
it one
is.
of their corporate names?
No, ma'am, it is. Yes, ma'am.
Do you have a waiting list for either of your nursing homes at this time?
Not at the moment.
And your capacity at the nursing home is the same, above, or below what it was last year?
It's the same.
And you'll give us some numbers on that, just
We can,
because you
yes.
have a changing thing. And what you've done in the past is that you reduced your population as budget money was needed,
Mhm.
but you're not in that posture anymore.
Not at the moment, no. Well, the problem that we're facing is still the same problem that we've been facing the last several years, and that is the death turnover rate. As we admit one, unfortunately, we lose one.
Right. I've never seen your calendar before. Is this the first year you've published it?
This is the 4th year we've published it.
Okay. How many do you publish of this? Print this? I just wonder what the
I
cost
think
of
it's
it.
roughly 25,000.
And what's the cost of this?
About 11,000 total.
And you consider this going to veterans? Or,
Yes.
Yes, ma'am.
We take them to events, we have them available in our offices. All of the certificate and pin ceremonies the commissioner talked about a moment ago, we usually take those with them, and we don't come back with them. They're left there and taken home by veterans.
Just one more question, Madam Chair. When I look at, I'm just comparing it to other agency budget requests, when I see a request for expanded offices, there's usually a kind of a work study analysis that would say how many people you're actually serving. I don't remember receiving from y'all an analysis of how many people you're actually serving. I see the veterans population for the state.
Correct.
But that doesn't tell me how many people are coming to your office.
Okay.
Or how many people are in the process, and how many people you're successful in helping get benefits.
We can provide those
That's kind of a
data.
work study analysis that generally goes with a request for expanded capital, expanded people, expanded even salaries.
Yes, ma'am. We can get that for you.
Thank you, Madam Chair.
Great. Can you get that for us pretty soon?
Yes,
We-
ma'am.
We
Yes,
need
ma'am.
it. That'll be
Absolutely.
great. Okay, Representative Taylor.
Thank you, Madam Chair. Just to follow up on Representative Oliver's question, on the Milledgeville facility, what would you say, just as a rough percentage of the utilization of that, and like number of beds filled, or would I?
Right now, I believe we're running 275 total beds. I'm sorry, that's the capacity that we have. We're running 210 regular veteran patients, and I believe the last time I looked at it was 19 to 22 service-connected disabled patients, and those are the ones that the VA pays 100% of the cost of care.
So roughly,
235 thereabouts.
Okay.
And it fluctuates.
235 out of 270,
Yeah.
so 80% or whatever
Yes,
that
sir.
number would be. Just to follow up on that, as a retired combat veteran myself, a lot of the nature of things have changed a lot, where we used to see a lot of fragmentation wounds or projectile wounds. What we're seeing now, and it's a tribute to our military medical care, is people having wounds that 20 years ago would have been non-survivable, traumatic amputations from IEDs, traumatic brain injuries, that it's a tribute to our combat medicine changes, but it's also going to require people with long-term major disabilities, and I just wanted to weigh in on that. Do you foresee, and multiple combat deployments, a lot of people have made a lot more deployments than they did, in any previous conflict. Do you see that number increasing over the years?
I think over time, yes, we will start to see that. That's part of the thrust behind the subacute rehabilitation therapy unit in terms of the post-traumatic stress, traumatic brain injuries, and amputees. That's what the focus of that is. Primarily, obviously, from the current conflicts in Iraq and Afghanistan, but those of us who served during the Vietnam era, we're starting to see some of our contemporaries who are retiring now, and where they were able to divert their thought processes into business or whatever it was they did for 25, 30, 40 years. That's no longer the case, and now they're ending up focusing on what happened to them back in Vietnam. And so the numbers of post-traumatic stress cases are starting to rise even in that particular cohort.
Thank you. If I can follow up with one more comment, Madam Chair. I just want to thank you guys for December a year ago honoring the memorial for General Ray Davis, native Georgian, Georgia Tech grad in 1938, three-war veteran, the most highly decorated Marine of all time. Was able to donate through his family all of his original medals and official portrait. And I wanted to thank you guys for working with myself. We had great ceremony. Commandant of the Marine Corps came in, and if any of you all have not had a chance to see that over in Veterans Hall in Sloppy Floyd, it's a tribute to a great American. I want to thank you for that.
Thank you. Representative Harden.
Yeah, first of all, let me thank you for all of the things you do for our veterans. And this Vietnam ceremonies that you've been conducting around the state have been, I just think, extremely helpful in helping to heal some wounds that were not physical from that war. And appreciate that very much. And healthcare is the area of veterans benefits that I'm most interested in. Of course, most of that comes through the federal government, as we know. But I want to thank y'all for being able to help our veterans navigate that system, which is a very complex system and can just cause many veterans to give up rather than trying to obtain their benefits. And I wonder, I know that the VA is building some new health centers, veteran centers around the state. Is that alleviating any of the problem that we've had with getting the health services for veterans?
I think as a gross statement, yes, because the access is now starting to be addressed by what the VA is doing. The key that you've got to keep in mind is that what the VA is building or contracting with in terms of existing facilities is outpatient oriented. It's the front end of the continuum. And what we're doing in our state homes, for example, is really on the back end. And so we're trying to take care of those who have been through the system at various points, receive care, and need follow-on care and continuing ongoing care. But the VA efforts in terms of their outpatient services we're seeing is really helpful in terms of access.
One follow-up, if you don't mind, Madam Chair. Do you see a time when our veterans will be able to get health care services locally as everybody else in our nation does?
Hopefully, yes. And I think that's been one of the thrusts of the incoming administration, at least during the campaign. That's been one of the policies that's been advocated. We'll just have to see how that plays out. It probably will be through some form of a voucher or payment mechanism, but I think that may be coming sooner than we may have anticipated.
Thank you again for all that you do.
Thank you, sir. Thank you.
Representative Henson.
Thank you. Appreciate everything that you've been doing. I know the coordination and the fact that you have a lot of additional people you're dealing with, given the Vietnam War coming forth, really has added to your increased caseload. I see that you've put down establishing the Women's Veterans Center, which you've talked about for several years, and I'm glad that you've done that. However, if you take one person who's dealing with a difficult case, such as some of the ones that you mentioned, mentoring people or having been sexually abused and going to court and so forth, that's going to be very time consuming. Will she have, I'm going to assume it'll be a woman that will have, will she have access to other people that can answer phones, do the administrative office work? Will she be located somewhere? Will there be someone that will be able to help her?
Yes, ma'am. We will, ma'am. That person will be located in our central office, but our plan is to have in the North and South Georgia different coordinators that she can assist her. Yes, ma'am.
But I mean, if she's in the midst of something, will there be someone, so a phone call
Absolutely.
does not
Yes,
go
ma'am.
unanswered for a week?
Right. No, ma'am, absolutely not. We will have someone there to assist.
Okay, great. And, okay, I know that we'll be talking to you further, so thank you.
Thank you, ma'am.
And Representative Kirby.
Thank you, Madam Chair. First off, appreciate your comparison on jobs. Question on that, though, did I understand you to say the VA itself pays significantly more than all these states? Is that who we're losing people to or competing with?
Absolutely, sir. I'll just give you an example. When we hire someone to go, or we bring somebody transfer them from the field up to our appeals division, we raise their salary to $28,000 a year. That person for a year will be up there. The VA will have their eye on them. The VA will come and say, Kirby, we've had our eye on you. You're a sharp guy. We want you. They will increase their salary to $58,000. So they'll start them, so it's a $30,000 a year increase.
All right. If you can get some of those numbers to us, we'd appreciate it, so we'd have those as
Okay.
well. Also, a couple more questions. On the disabled veteran license plates,
Yes, sir.
it's my understanding that the 100% total disability that Georgia requires is significantly higher than a lot of other states. Is that accurate, or do you know?
Sir, I'm gonna let Assistant Commissioner Canavaggio, they did change that. George, if you would.
Our requirements have been changed to make it a lot easier. They don't have to be permanently and totally disabled as it used to be. The number of issues that a veteran has been loosened, so it didn't have to be specific to being blind or amputees or somebody who just has the straight 100% scheduler. They have included the individual unemployability and just the combined issues that people have for whatever disabilities, make it a lot easier for them to go in and get their license plates and homestead exemptions.
But you want to now 50% or higher?
50% or higher.
50% or higher.
50%?
Yes, sir. Yes,
All right.
It's not 100 anymore.
And then one last one, on the Gold Star license plates, can you all generate or give us the numbers or the cost if we totally eliminated the fees to the families for a Gold Star plate on an annual basis?
Dan, do we know what? We'll certainly check on it, Representative Kerr. I don't know what the fees are right now, but we'll certainly check on that for you. Absolutely.
Great. Thank you. Any other questions from the committee? Well, that concludes it, and I thank you for it. There will be more, and we will be
Thank you,
gathering
Madam Chair.
again.
Yes, ma'am.
And I know there'll be some questions to kind of follow up with on some of those numbers, but
Thank
anything
you,
we can do
ma'am,
to
and
help
thank
you.
you, committee, for your support.
And thank you for your service
Yes, ma'am.
always. Appreciate it. I want to thank the committee especially for being here. It went a little longer than projected, but it was a very good discussion. And I think we've had some great questions come up. There's more to follow up with, I know, and we will be addressing those issues. Two, I want to make sure everybody knows Leo Chanson, our new analyst. He's going to be a great addition to our committee work this year. And this was a nice early start. I hope we were able to do it all in one meeting. Some of you may have other hearings that you're interested in over the next few days. And just look forward to working with you starting very soon. Appreciate it. We are adjourned.
Good job.